Hi, I'm James Phillips, the Veterans Commissioner for Wales, and I've been the Veterans Commissioner since June 2022, which is when I retired from the Army after 33 years service with the Royal Artillery. In fact, I spent quite a lot of time in West Sussex, or the borders of West Sussex and Hampshire, at Thorney Island. My role is the newest of the commissioners. It was the last to be appointed, and the role is similar to that of Scotland and Northern Ireland, although each is obviously distinct with its own nuances and political subtleties. The Welsh Commissioner is, much like the others, charged to ensure that veterans within Wales are not disadvantaged by their service, and that the devolved government, Welsh Government, apply the covenant, the due regard, and do their best by the veterans who live in Wales, and there's about 115,000 of those, and then obviously their families. The challenges in Wales are no different really from those of England, Scotland or Northern Ireland. It's predominantly at the moment economic in terms of the National Health Service for health, but also cost of living, housing shortages are what I would say are the main challenges. But obviously if we're talking about health, and particularly mental health, then that is an area where Wales has a slightly different approach to England. Obviously in England there's a holistic sort of op courage which covers all sorts of mental health services, from addiction through outpatient sort of 9 to 5 routine counselling appointments, right up to high-end intervention and crisis. In Wales we have Veterans NHS Wales, which is our bespoke pathway, but it differs from Op Courage in the fact that it only provides that outpatient sort of 9 to 5 counselling service. It's self-referral, referred by GPs or family, so that part is the same as Op Courage, but as I said, it doesn't have that high-end intensive assistance and support that Op Courage can provide now in England. What it does very well, Veterans NHS Wales, although it does it on a shoestring, and the funding that Op Courage enjoys per veteran is about double that of what Veterans NHS Wales spends, or NHS Wales spends on the mental health pathway. So I'm working closely with Welsh Government and the 7 health boards that provide primary and secondary healthcare services across Wales to try and bolster up what is really quite a thin offering, trying to ensure we level up with those services that Op Courage provides in England. That's challenging at the moment. We have junior doctor strikes, we have an NHS in crisis, and we have NHS in Wales where waiting lists and referral times are longer than the equivalent in England.